Good morning, everyone, and thank you for joining us today. I'm Joe Zymans. I'm a consultant with Forward Health Group, and I'm going to be our moderator for our time together. Joining me, we have Amy Mosier-Garvey, who's our Director of Account Management, and she's also a practicing clinician. And we have Jake Mosko, who's also part of our consulting team here at Forward Health Group. We'd like to thank Tracy Myers-Preston and the Maryland Addiction Disorders Council for collaborating with us and allowing us to all come here together today. So just a couple of housekeeping things before we get started. If anyone's having any issues with being able to see and hear us, we would suggest that you use the phone call-in number for the audio, and then just go ahead and use that computer link to view the presentation. If you're running into any issues, you can always chat with us and use that webinar control box and let us know, and we can hopefully troubleshoot with you. We are going to have a Q&A session here about 20 minutes from now, and so if you have any questions that come up along the way, go ahead and send those to us as you think of them, and you can use that question box on the webinar control box as well, and we'll take those and read off as many of those as we have time for. And finally, this webinar is being recorded and will be available online, so as soon as we get that posted, we'll go ahead and send out an email with a link so that you can refer back or you can share with your colleagues. So let's go ahead and get started. And we thought we'd start with an image that probably represents healthcare as good as any out there, especially right now in these times. And I'm sure most of us at one point or another have looked at a sign like this or thought of looking at a sign like this and wondered, where am I within this healthcare mess? A lot of arrows going in a lot of different directions and not sure which direction to head. So we know for most of you, you are somewhere on this continuum of moving from being grant funded to operating in a fee-for-service model, and at some point over the next couple of years, you're going to be moving into this value-based payment system. We also are seeing a lot more integrated care models coming up. You may be involved in some where we're bringing together primary care, behavioral health, and some community-based social services all in one unified care model. We know that our substance abuse continues to be too high, and we still have too many in our community landing in the ER and in jail. Certainly, we understand the opioid addiction and how it's decimating our communities, and that's something that we know is going to require a lot of effort, a lot of people coming together, and a lot of different solutions if we're going to reverse that trend. So the question really is, how do we adapt, and how do we change the way we do business and provide our services so that we can not only survive, but that we can actually thrive? So that's what we're here to talk about today and help answer that question and present what we think can be a significant tool for your toolbox, and that is population health management. So we'll talk a little bit about what that is and the main components of that, why we think it's a significant part of any integration or value-based care model. And from there, we'll show you a few examples so that you can see what we're talking about in action, and Amy will demonstrate Population Manager, which is a population health management platform as an example. And we'll also show you an example of some technology that can help with this opioids addiction epidemic that's out there. At that point, we'll open it up to those questions and we'll answer as many of those as we can in the time that we have, and that'll take us up to the end of our 30 minutes together. So just a little bit about Forward Health Group. So we are a healthcare technology company based in Madison, Wisconsin. We do focus on population health management and data collection. We are very proud of being the top-rated population health performance business in the 2015 class report. And that really is based on a body of work that we've developed now over many years across the healthcare spectrum. We've worked within primary care, specialty care, as well as mental health and substance abuse services. And the origins of that work really goes back to a time about 12 years ago when our core team actually developed what became the first public health reporting initiative in the U.S., something called the Wisconsin Collaborative for Healthcare Quality. We take data security very seriously, especially in the business that we're in. We go through an annual SOC 2 Type 2 compliance audit, which is one of the most significant things that you can go through for data security. And we do work with a variety of healthcare organizations, including the American Diabetes Association, the American Cancer Society, and the American Heart Association. And what we do there is we provide a platform for collecting and reporting on a variety of healthcare measures through something called the Guideline Advantage. One last point, we're also a qualified clinical data registry, so we're registered with CMS, we're able to collect and report your data back to government agencies. So I'm sure there are a variety of definitions out there about population health management. But for us, really, the key is this ability to apply specific strategies and interventions to groups that you've identified through some predefined measures. And in doing that, you're able to provide the right care to the right client's population at the right time. And that's really all we're talking about. So population health management is something that can be a significant contributor to integration and value-based care. And there are several reasons why. And it really starts with being able to get all of the data in one place. If we think about an integrated model with bringing together primary care and behavioral health services along with community-based social services, it's important that all that information come together. And that can be a challenge, especially if we're talking about different organizations working together with different systems. Once we have that in place, then we're able to visualize what's happening across the care spectrum and start to identify those comorbidities. And an example of that might be that you may have an intervention to help with someone who suffers from both depression and diabetes. And so having a way to efficiently get to an understanding of which clients within your population suffer from both of those things would be an important component to providing that care at the right time. So the other thing that you're able to do with population health management is really start to show the impact of social determinants on health. And this is something that you're experts in already. This is really at the core of the services that you've always been providing, really since the beginning of time. And healthcare is just now starting to get it and starting to catch up. So you have this unique opportunity now to be able to bring your expertise and bring your value add to this overall healthcare equation, especially when we're talking about a value-based care model. So once you have all that information together, then being able to very efficiently and quickly get to and engage your at-risk patients or clients, understand the gaps in care, and in some cases be able to identify some behavior that may be suspect with prescriptions or system utilization. And then finally, with population health management, you are able to do a good job of monitoring the overall performance of this healthcare model. So whether it's at a physician level across your physician panel or within a clinic or across all of your locations, as well as at a system-wide level, you're able to really monitor and understand the overall performance. So these are all components that really go into this approach called population health management, and we think it really can be a significant tool in your toolbox, as I said, for integrated care and value-based care. So with that, I'm going to go ahead and turn it over to Amy, who's going to demonstrate Population Manager, and you can start to see some of what we're talking about in action.
Thanks, Joe. So I'm a Director of Account Management here at Forward Health Group. I also am a practicing clinician, as Joe mentioned, and I do have a dual diagnosis clinic here in Madison, Wisconsin, and have been involved in a number of efforts at the community level addressing the opiate epidemic that's really plaguing our nation at this point. And I'm so excited to be able to talk to a group of people who also seem to be engaging this coordinated model of care in order to address this serious health issue that's in our population right now. When I think about what we're going to need to do in order to tackle this problem, it really does need to truly be a coordinated effort between clinical care, administrative oversight, access to data, and certainly technologically coordinated programs that allow us to see the patients that we're working with, both from the patient level, the clinic level, the provider level, and overall at the system level. And it sounds like your effort is uniquely suited to do this very well. I'm just going to flip out just for a second and start to switch over to our demo. What I'm about to show you is a tool, a platform called Population Manager. This is a very fake but very good fake system called the Capital Health Behavioral System. And this is, as I said, all very fake data behind the scenes. So I'm not disclosing any PHI to you. This is one of our demo sites. This particular demo site was set up for a SAMHSA grant that we are working with, the Primary Care Behavioral Health Integration Grant. And so what we did here is we tried to create a vision for those grantees that would fit with what they were doing. It's a nice model of integrated care, so I'm going to start here with this platform. When we talk about needing to have an integrated approach to treating the opiate population, one of the things that we need to talk about is kind of how do we integrate our clinical care with administrative oversight and kind of system level view. So what you're looking at here is just the home screen for Population Manager, and you can see that as you look here, you can actually just go ahead and, right now we're looking at an overall view of all clinics, but we can certainly slice and dice in any way we want to. So now we're looking at just those patients who are being seen at the Oakland location, and we can also further drill down to look at just those patients who are on Dr. Drigan's caseload. You could also imagine this being a mid-level provider, a master's trained clinician. We can sort of slice and dice this any way that fits for your system. What we have below then is simply different groupings of measure sets. So there is a group of behavioral health measures, physical health measures, NOMS criteria, the national outcome measures. We also were tracking some wellness goals for our grantees, and then also an example of a specific population that we could track as a cohort to look at improvement across just a specific group of patients with a diabetes diagnosis. So how this works is really, it's pretty intuitive. You want as many people to be in the green as possible. So over here, if we're going to look at how many people have been screened for depression, we have 86 people on Dr. Drigan's caseload at the Oakland Clinic who were screened for depression and 128 that were not. This is the clinical platform. This is the tool that we use to help providers manage their patients. So one of the things you can do is simply click into that list of patients, those 128 patients who have not ever had a PHQ-9 screening done. Here are those patients right in front of you. And again, any of these column headers across the top can be customized to fit with what your needs are in your system. So if you have something other than payer, if you want to look at something other than race or ethnicity, perhaps there's a NOM status that you want to include in here around housing stability, we can go ahead and include those for you. And then at any point, you can go ahead and you can just click into a specific patient, and you can see a patient level scorecard for this patient. So again, green is really good. This patient has had a lot of screenings and evaluations done. You can see integrated data from multiple systems in one location. So if you're in a system where maybe the medical providers in your community are using one EHR and your behavioral health providers are using a different EHR, or you're loading data from other disparate data sources, all of that can be combined into one location so that we end up with a much more comprehensive view of the patient at the patient level. The other thing that you can do, we can look at historically trended data. So these are all of the BAM scores that were done over time. You can actually view those. So for this one, we'll just stick with our, let's look at BAM alcohol and drug use over time. So this is the patient's use as they reported on their BAM, so you can track this over time. This is also a nice motivational tool that you can use at the point of care with your patients, with your clients, to help them understand how their progress looks from one point in time to another. Other functions of this particular platform, we can create action lists. We can take this is now looking at Dr. Drigan's population in the Oakland Clinic. We're looking at patients who have had a PHQ-9 done. You can sort last test result in ascending or descending order. These are people who have not had one done, and as you would scroll through, you would find the folks who have had them done, and then those are stacked up in terms of order. You can also create action lists. If we go back to our home screen and we take a look at those patients who maybe have not had a PHQ-9 done, in terms of managing your patient population, We're now going to send out an action list. We're going to create an action list. We'll call this Need Depression Screening. And we're going to create this action list. What we have now is we have all of these patients in an action list that can be exported to Excel. It can be sent to a team that you create within Population Manager. So you can imagine if this is an integrated care team, this could maybe go to a nurse navigator. This could go to an administrative assistant to call or reach out to these people. It could go to a master's level provider in behavioral health to let them know that their patients have not been screened. And then as you work this list, this is a real-time list, so you can go ahead and just enter the updates, and anybody who's working on this list, the list will update at the same time no matter how many people are in it. You can send an email notification out to your team letting them know that an action list has been created. The data all lives in our secure environment in the cloud, so you're not ever sending PHI out of the system. The users would simply get a notification that this action list had been created, and then they would go into Population Manager to work the list there. If you choose to export it to Excel or another program, then what you choose to do with it just complies with your own internal IT policies. We have some other features built in that help us kind of look at these patients in different ways. And so this is called our Populations tab. And if you're familiar with the concept of a Venn diagram, right now what we're going to look at is we're going to look at all the patients, again, Dr. Driggins, Oakland Clinic, and then just for a second I'm just going to give all clinics just to give us a little bit bigger number. So these are now all patients across this entire Capital Health system who have depression. There are 1,015 of them. So each dot represents 5 patients who have a diagnosis of depression. I also would like to see those patients who have a comorbid substance use disorder. Those patients exist right here in the overlap of this Venn. And at any point I can click on that and just show those patients so that you know who those patients are that you then need to work with. I can also overlay how many patients have a stable place to live. I can then change that and show those selected patients. So it's pretty intuitive, it's pretty user-friendly. You can then go ahead and create action lists, or you can create groups. You can tag those patients and follow them. You can do different things with those patients once they've been created. Metrics is a little bit fancier view, a little bit more opportunity to drill down with data. I'm not going to show you a lot here because I do want to get to the next part of our demo, which talks about what we do at more of a systems level view. We'll see if this will load for us. There's a lot of data loaded in our database behind the scenes, and sometimes it takes just a minute. Actually, you know what? In the interest of time, I'll let that load, and I'll come back to it. Here is, when I talked about needing to have a coordinated effort, imagine then for a second that that data that you've taken from your EHRs, maybe from claims, whatever data you have access to, if you're running a health maintenance organization and you are both the payer and the provider, you may have access to a whole breadth of data. If Population Manager, the platform I was just on, is your clinical tool, let's talk for a minute about how we then get a broader view administratively using a little bit different set of data. Let's throw claims data in the mix. Or let's dream big for a second. If you are like me, one of the things I dream about doing here in my own home state of Wisconsin is having access to PDMP data. Imagine loading PDMP data, and then imagine loading claims data. And what we're looking at now, this is called our Orbits demo. This is a patient. This is Jeremy Smith. He's 26 years old. And we're gonna scroll through. This timeline on the bottom essentially is like a marker of things that happen in Jeremy's life over time. So in February, Jeremy went and saw his primary care provider. And if I scroll over that box, it shows us that he had a charge of $200 and he was prescribed metoprolol and warfarin. Oh, and by the way, he was also given 2 opiate prescriptions. Now, anything that is circled in green, you can see these circles are green, those were done in Spruce Valley. The primary care provider is a Spruce Valley provider. So what we are imagining right now is that Jeremy is accessing his care through Spruce Valley through the home HMO. And those visits show up down below. As we scroll through this, and just kind of, I'm going to go through this a little bit quickly. So So let's move out to 180 days, the first 180 days that Jeremy has been in the system. And what we begin to see now is a pattern of utilization across the system. We can see that Jeremy had a hospitalization with an outside network. We can see that Jeremy went to an ER with an outside network. We can also see that Jeremy seems to have an opiate prescription filled with CVS Pharmacy that didn't come from another provider. Now, it could be that that was an opiate prescription that was written prior to Jeremy's engagement with our healthcare system. It could be that Jeremy got a prescription from somewhere and that we would want to follow up on that to make sure that that was a legitimate prescription. It could mean a number of different things. Now, we can do a couple of things. We can take a look at this 180-day period over any point in time. And again, at any point, we just scroll over, and you can see the charges, the data that make up this particular circle. So during any given 180 days, you can look at the charges. And the total sum of charges is going to show up over here on this side. 14 encounters in those 180 days. Now, you can also mark things. If you would like to look at, I would like to see the number of times that Jeremy showed up in an ER. Those are now demarcated with this kind of pinpoint here. And every color represents a different system, which of course is color coding up on top here. So Jeremy has been in Magnificare's ERs 1, 2, 3 times, and has also been to Orion Care once. If we want to look at the overall picture, let's look at Jeremy over a longer period of time. Let's really build out where he's receiving his care, where his prescriptions are coming from, where his cost is. We can just pull that out for the whole length of time, and you begin to see patterns. So there are 17 opiate prescriptions, right, that have come from his primary care provider. There are 7 opiate prescriptions that have come from outside of the Spruce Valley network. There are 2 prescriptions that seem to have come from nowhere. And then there are an additional 8 opiate prescriptions that have come from other outside systems. Now, some of them could be very much legitimate. Looks like maybe Jeremy had a fall, had some ortho care. That came out of his ER visit. Looks like he may have also had some kind of a neurological event, received anesthesia, had an MRI, and got some opiate prescriptions that way. At any point in time, you can also change this. So right now we were looking at number of counters. If I switch it over, instead of encounters, we're looking at total charges. Again, anytime you scroll over that circle, you can then begin to see the total data behind the scenes that make up that number. And then finally, just some interesting things that to kind of pique your imagination a little bit. Right now, what we've chosen to highlight is that for this patient, you can see the different systems by color of the outside circle, the number of charges or dollars spent by the size of the circle. But we've also chosen to highlight green. We've colored in the circle for the primary care provider, and we've chosen to highlight red, looks a little pink on this demo, for any opiate prescription. And you can go ahead and customize that. Imagine customizing that for anything you would want to. If you want to color in any circle with gray that is a service that's provided outside of your home network, or you know, the possibilities are really sort of limitless. I think that gives you a taste of sort of an integration between, you know, how this would work is if you were in Population Manager, you would select the patient that you wanted to view. There would be a link on the right-hand side that would take you directly to the Orbitz demo, the Orbitz view for that patient. So there would be a link over here, and you would go right into the Orbitz view, which gives you an opportunity to have a coordinated technological process that allows you to visualize your patients in a different way and give you the opportunity to identify patterns of utilization, to identify patterns by patient level, clinic level, system level, state level, county level, you name it, that gets to happen within this system. I'm going to go ahead and turn it back over to Joe and give you an opportunity to ask some questions, and we will see if we can answer or clarify anything for you.
Thank you, Amy. So I think we may have a question or two that have come in, and we'll see if Jake can go ahead and facilitate that.
Yeah, thanks, Joe. Yeah, so we have first question here is from Stephen. He's asking, how are you acquiring data from CVS showing that Jeremy filled an opiate prescription? So I don't know if you want to take that one.
Sure. So again, we have a fictitious population with fictitious data access. What we've done in other locations varies. So again, if you are the payer, so if you are both the payer and the provider, you will have claims data that will show that claim has been paid. But if you're like me and you're a provider, you know that a lot of those patients are also getting prescriptions that are not being paid for through their insurance. In these cases, we like to work with providers and coalitions like your larger coalition to leverage larger access to data from someplace like Caremark, who does all the prescription services for CVS or other national pharmacy chains. We would work with you on building those bridges to data sources. That's something that we would do with you over time. If you don't have that data feed coming already, that's something that we would work with you to develop. So when you engage Forward Health Group, you get not just the platform, but you also get our services as a support behind the scenes to help you make some of those connections so that the platform is the most meaningful for you.
Great. No other questions from the group right now. Feel free to enter those into the question box into the webinar tool. We'll take those. I guess in the interim, we have a few minutes, so maybe, Amy, if you could talk a little bit more about what is the typical user that we would expect to see for Orbitz. What kind of role would they have within the organization, do you think?
I think for the population manager platform, you're probably looking at a direct service provider or an administrative assistant who is helping to coordinate that. The clinics and the healthcare systems that we work with currently customize their use of the tool just the way they customize the tool. So in some clinics, there is a propensity to not have higher paid professionals like physicians logging into this as a tool because they view that as valuable direct care time. So those sites may use more of a nurse navigator or even a medical assistant to manage some of that. Other sites really want to put the data for improvement in the hands of the providers that are responsible for doing the improvement, and in those sites we see physicians, mid-levels, clinical providers using this tool right alongside their EHR at the point of care. In terms of Orbitz, that's a little bit more interesting proposition to me, and it's one that for me is maybe more intriguing in the opiate world because that gives us a view that we've not really had so far. And as I mentioned earlier, I would love to see this tool being used in a broader application, either at a state level, at a coalition level, and really populated with that data that we haven't been able to get as providers. Now, each physician clearly has access to the PDMP and can look at things, but it's a one patient at a time view. If we could get an aggregate level view of that across all patients, across all systems, to me that would be a more meaningful use of that data. As is the case in many areas, the data's there. We just need to harvest it and use it to improve the care for the folks that we're serving.
Great. I guess lastly, maybe one final question on Orbitz. I know in my conversations recently, I've had a question come up about point of care alerts for the future, and can you comment at all about what the sort of future development for Orbitz looks like? Anything that's coming down the pike that might be interesting?
So in our ideal waving of the magic wand for the future, what we would love to do is to be able to have coordinated alerts at the point of care that come from data that is in existence in the EHR, coming from Orbitz, coming from any one of our multiple data sources, but kind of coalesced in our hub of information so that those alerts would then trigger point of care notifications through the EHR or back through those points of origin. So if you're, for example, if you happen to be an Epic user or a NextGen user or an Allscripts user, and we're pulling the data out of Allscripts, we're aligning it, cleaning it, making it meaningful, we would then like that data to flow back into Allscripts, back into Epic, back into NextGen, so that when you're sitting with the patient, that alert of what that patient needs to have done, or imagine customizing it any way you wanted to. You could take that notification, and it could be any patient that has more than 3 scripts filled in a 90-day period for a long-term analgesic agent. There's an alert that pops up for that patient at the point of care so that the physician is at least aware that that's happening. And that kind of is where we'd like to go in the future, using Orbitz and combining it with the EHR data that's available there clinically.
Great. So that's all the time we have for the questions. I'll pass it back over to Joe.
All right. Well, I think we're at the end of our time here. So we will send out a link to this recorded webinar and presentation, and you'll have that so you can refer back or pass that along to your colleagues. If anyone would like to talk more with us about population health management or learn more about the work that we're doing, please feel free to reach out to us directly at bh@forwardhealthgroup.com. You can also call us at that number on the screen. And we'd like to again thank Tracy and the Maryland Addiction Disorders Council for inviting us to be here today. And with that, enjoy the rest of your day. Thank you.